comments. Tonight we will focus on Operation Vaccinate the Virginia Peninsula. My name is Cindy Williams, and I'm a pharmacist. My role currently is Vice President and Chief Pharmacy Officer of Riverside Health System. One of the roles that I play at Riverside is coordination of COVID-19 vaccine efforts for the health system. In that role, I've had the opportunity to collaborate with local jurisdictions, the Department of Health, both at the state and local level, and many community partners. Our goal tonight is to provide an update on the vaccination efforts on the Virginia Peninsula and talk about some of the successes we've had as well as some of the challenges that we faced during this campaign. I'm joined this evening with three other panelists that I'd like to introduce. I'll start with Christopher Mccain, who is seated directly to my left, and Christopher is a young professional that lives on the Virginia Peninsula, and he will be giving his perspective on vaccination. I'm also joined by Dr. Natasha Duamena. Dr. Duamena is the director of the Hampton and Peninsula Health District Department. And then I've also joined by Pastor Kevin Swan, who is from Ivy Baptist Church in Newport News. So I'm going to start off the evening just giving a little background on the vaccines that are currently available in the United States. Back in December of last year, the Pfizer-BioNTech and the Moderna vaccines were both given approval by the FDA for use in the U.S. Both of these vaccines use messenger RNA technology, and both do require 2 doses. The Pfizer vaccine is approved for use in those that are 16 and older currently, and the 2-dose regimen the second dose is given between 21 and 42 days after the first. The Moderna vaccine at this point is only approved for those 18 and older, and the second dose is given at 28 days or at 42 days, or between 28 and 42 days after the first dose. Back in February, another vaccine was added to our menu of options, and that is the Jansen, Johnson & Johnson vaccine. That vaccine does use different technology, which is a viral vector technology, and is only a single-dose vaccine. When approved by the FDA, it was approved for those 18 and older. As many of you may be aware, several weeks ago, the FDA and the CDC did put a pause on the Johnson & Johnson vaccine due to some unexpected side effects. That pause has since been lifted, and later in this broadcast, we will give a few more details around the current status of the Johnson & Johnson vaccine. I would now like to turn the conversation over to Dr. Duamena, who will talk a little bit about the status of COVID on the Virginia Peninsula and more specifics around our vaccine efforts.
Thank you, Cindy, and thank you for the opportunity to speak to you all. As is mentioned, my name is Dr. Natasha Duamena, and I am the Health District Director for both Hampton and Peninsula Health Districts. We serve 6 localities, 4 cities and 2 counties in the Greater Peninsula. Currently, the cases of coronavirus infection is decreasing statewide, and the peninsula is consistent with that trend. The case positivity rate within the eastern region is approximately 5.7% over a 7-day average, and the peninsula is approximately 4.7% within the last 7-day average. So we're definitely seeing improvements in the infection rates. As far as our vaccine rates, we are doing well thanks to the collaborative effort between the health district, the local health systems, and the locality leadership. And that coalition is called Operate Vaccinate the Peninsula. And it has allowed us to accelerate vaccine delivery throughout the peninsula, primarily in our large sites throughout the community, as well as our smaller clinic sites at the health department, including the Senior Center in York County, as well as university sites, Christopher Newport University and Hampton University. So we're very happy to be able to provide a vaccine in various ways, whether it's through the hospitals, through clinics, or through pharmacies. So we are definitely trending in the right direction. We are continuing our efforts to vaccinate people, to educate residents, and provide vaccine to those who want it.
Thank you, Dr. Dwamena. I'd now like to turn on to Pastor Swan and let him share a little bit about his experience, because he's been very active in the community collaboration around vaccine.
Thank you, Cindy, and it's great to be here this evening. And as a part of the faith community, we know that it's very important for our communities, especially those minorities, have a place that they can trust. I believe historically, minorities have not been as trusting of certain systems, and having these opportunities of vaccinations at churches and other locations have been very, very vital in our community. Our church in particular has had two partnerships, one with you, Miss Cindy, with Achievable Dream as well, Dr. Lee Vreeland through Riverside Hospital, and those have been done at Achievable Dream, middle and high school, and at the academy. And then secondly, our work with Centera, Nurse Iris Lundy, those vaccination clinics have been at our facility each week. It's important because these two opportunities are in the Southeast community where it's predominantly minority based, and having access to the vaccine has been critically important. And while there is a benefit to having the vaccinations at larger sites like the Hampton Roads Convention Center and other places, there's still great value of having them in the communities where people trust.
Thank you, Pastor Swan. And now I'm going to turn it over to Christopher, who's going to give us some information around his journey with the COVID-19 vaccine.
Thank you so much for the introduction, Cindy. So you might be wondering why I'm here, and I wonder the same thing, but I work for the Hampton Public Library System for the City of Hampton, and I kind of help not only those in our community kind of get access to vaccines, whether they call the library and ask where to get vaccinated, but I also dedicate some of my time and volunteered at some of our local clinics at the Hampton Roads Convention Center. And one of the things that really inspired me was getting a vaccine and then being able to help other people get that same vaccine, whether that was registering them, checking them in, screening them, or even helping some of the frontline workers and medical professionals who are administering the vaccines get the proper materials that they needed to administer those vaccines.
Thank you, Christopher. And I had the opportunity to work with Christopher at a couple of those clinics, and I've certainly worked with Pastor Swan at a number of the Unachievable Dream clinics, and it has been a great community collaborative. So we are going to be taking questions from the audience, and so if you can start thinking about those questions and put those in the chat function, we'll start collecting those. But we have a few questions that have been posed to the local municipalities that we'd like to start with, because we think these are common questions that may be on folks' minds around the vaccine. So I'm going to start with Pastor Swan, and I'd like you to talk a little bit about vaccine hesitancy. We know there are folks that out there that have maybe, said they're not getting the vaccine, or maybe they're on the fence right now. Can you talk a little bit about what you're hearing in your community and with your parishioners, and how do you respond?
Yes, I do think vaccine hesitancy is still a concern. It was a concern for me in the beginning. And what I decided to do is to really educate myself. Finding the right sources, I think, is most important, of where to go to get information. Unfortunately, social media can be a good place to share stuff, but you don't always get the correct information. And so going to reputable sources in the medical field was one place that I went. Other videos where people who had experiences with vaccines, who could speak in layman's terms about what the vaccine was going to do, what it wasn't going to do, was very helpful to me. Again, going back to the minority community, there's been a history of mistrust. And I think that that's one of the reasons why there's hesitancy, going back to things like the Tuskegee experiment. But I do believe that as more people have become educated, especially within the faith community, as these vaccination clinics are being offered in other places, as leaders are also showing and demonstrating their desire to get vaccinated, I think you put all of that together, and it's helping people to say, you know what, it's okay for me to get vaccinated. We still have a long way to go. People still need to educate themselves and feel comfortable about it. I know Chris will talk about the millennial generation and why we need to make sure that they get vaccinated. But I would just simply say that for me, my reason for getting vaccinated was because I have two parents and I was very concerned about being around them without being vaccinated and them being vaccinated. So I wanted to make sure that I had the chance to be around my family in a safe environment without worry or concern of their health and mine, which was the primary reason why I was vaccinated. So each person has to have their own decision of reason why they want to do it, but being educated is the most important thing.
Great. Thank you, Pastor Swan. Since you mentioned the younger residents on the peninsula, there have been some articles, I think, or we're seeing some things that individuals in their upper teens, early 20s are saying, why should young people get the vaccine? Because we're healthy and maybe we're not at risk. Even if we get COVID, maybe it's not going to be that significant. So perhaps, Christopher, you can talk a little bit about what made you decide to get the vaccine and what you're hearing from your peers in the community.
Of course. So what kind of made me want to get the vaccine was I was very anxious about the pandemic when it first started. I kind of knew about it a little bit from social media, specifically Twitter, back in November. So it just kind of spiraled from there, and I was just a little bit more conscious about washing my hands and making sure that, I was doing my part to kind of like distance myself from people and cover my mouth. But I let this fear kind of consume me, and it was very unhealthy for my mental health. It was not okay for my physical health because I was always stressing about, well, if I don't do this, if I don't shower immediately when I get home after coming home from work, I'm going to spread it to my parents, or I'm going to spread it to a loved one. I can't see a lot of my friends anymore, and it just had like a huge toll on my mental and physical health. So one of my biggest reasons for getting it was kind of trying to ease that portion of my life, and by having the vaccine and knowing that there was a lot of research, a lot of money that went into it, and so many things that kind of just made sense around it. Within the medical community, it just felt like I should do my part and get to it. We talked about it a lot when I was in school, from high school all the way up into college and even community college at Thomas Nelson. We talked about what the next big pandemic could be, and to actually like live through it after learning about it for so many years was just kind of surreal. But one thing that gave me reassurance was my professors would always tell me that in order for those things to kind of subside is we need to have herd immunity. And that's the kind of thing that happens when people who can and are able to get the vaccine, because there are some people who cannot, for whatever reason, health disclosed, can't get it or get access to it. But if we have at least 80%, or a good percentage of it, of people who choose to get vaccinated, we won't see a lot of the downsides of the virus and what it may do to our immune systems and our bodies. So that was one of my main reasons for getting vaccinated. As for my peers, from what I've seen on social media, everybody who wants to get the vaccine tries to get it, at least in some shape or form. That may be because I come from a place of more privilege, and I grew up with a lot of people who went to college and had access and opportunities to these kinds of things. But, again, I try to stay connected within the community and make sure that people, whether I'm friends with them or, if I just see them on the street, they have access and they have the information to get a vaccine should they need to. So I'm a big advocate for it, and just trying to make sure everybody stays safe and healthy and happy.
No, I think those are great points. And I think one of the things that we don't often talk about with the COVID-19 or the coronavirus pandemic is, there's obviously the impact of getting active COVID disease and all of the negative health effects that can have. But we don't often talk about the mental health impact, and we all know there's been a mental health impact with not being able to, whether it's a stress from the disease or not being able to see loved ones. I know I personally have, parents that didn't leave their apartment for a year, and what that's done cognitively to them has been very difficult because of just the isolation. So, now that we are getting closer to herd immunity, I know yesterday there was a big announcement with the CDC related to masking. So I don't know, Dr. Dwamena, if you want to give a couple of minutes talking about what these new guidelines are related to as far as masking outside if you've been vaccinated.
Gladly. The CDC has made recommendations, new recommendations have come out regarding mask wearing, and primarily for those who are vaccinated, mask wearing is not necessary when outdoors. However, it's still recommended when indoors. And that is definitely a step in the positive direction. And I believe it's something that is definitely welcomed, similar to what was mentioned earlier, the effect of isolation that has been brought on by this pandemic has had far-reaching mental impact on a lot of people. So having that additional added freedom is definitely beneficial to the mental health of residents and of communities and the reemergence of communities. And so having that additional guidance is very much welcomed and a positive step in the right direction. However, it's important, again, that we are not quite out of the woods and that face mask wearing is still recommended, and it is still beneficial to decrease the rate of transmission of the virus in our communities. The virus is still present in our communities, so again, this isn't a time for us to be less vigilant. It's a time for us to continue to be vigilant with providing access to vaccines, but also access to the appropriate education, and that was referenced earlier. And similarly, that is partly why the health district has made concerted effort to provide access and diversify the channels and means by which people can receive a vaccine in the community, whether it's at their local pharmacy or the health department, or through community clinics that we have actually supported, as well as Riverside and other health systems like Centera in our community. Now our approach is actually going out into the communities. We recognize that for different social determinants, people may not be able to come to the sites that we have had. So our ability to go out into the communities now that more vaccine is available is definitely a positive step in the right direction.
Great. Thank you so much for that. You know, one of the other things that has been in the press over the last couple of days, and I think is a question on folks' minds, is the issue of individuals not getting the second vaccine. We do know that both the Pfizer and Moderna vaccines are most effective when that second dose is received within 42 days of the first dose. And there was a publication yesterday that said roughly 8% of Americans have not received their second dose of those vaccines, and there could be a number of reasons. In some cases, they may not have been able to find a clinic, but we do know that more and more clinics are opening, and for those in the audience that are watching this evening, there is a great tool that's called Vaccinefinder that is available, vaccinefinder.org, where you can put in your zip code and you can actually search by the type of vaccine that you're needing, so that if you got a Moderna first dose and you need a Moderna second dose, you're able to find within your region where those vaccines are being offered and then link through to get those appointments. But I also believe that there are individuals that, know that there is some activity after the first dose and have decided not to get the second dose. And, I think that at this point, that's clearly not the recommendation. We don't know how long immunity after that first dose will last. There's also concern with the variants that we're starting to see, not only outside of the United States, but in the United States, and how that's going to impact the effectiveness of the vaccine. And so the recommendation is still to get that second dose of vaccine. And even if you've gone past the 42 days, it's still not too late. You don't need to start over again. Make an appointment and get that second vaccine. Really, the only reason that an individual should not get the second dose is if they've had an allergic reaction to the vaccine, either immediately or soon after getting that first dose. So we really encourage individuals, use vaccinefinder.org, go out and find a vaccine clinic, and make sure that you do get that second dose so that you know that you've got the full effectiveness of the vaccines on the market. I'd now like to ask a question of Pastor Swan. We know that early on, the faith-based community has been significantly impacted with COVID-19 related to being able to get together, in person in order to worship. And I think that most churches and other houses of worship have done a phenomenal job with using Facebook and other mediums to do that. But are people now starting to return to church? Or are you still primarily offering virtual services?
I think it's a combination of both. In our context, we still are not yet in our building. We do have a plan in place of a date that we will return to the building to worship. I do think it depends largely upon each individual church and the makeup of their congregation. Our congregation, we have experienced, unfortunately, a significant amount of transitions due to COVID. So you can imagine that there's some hesitancy about people returning to our building to worship, whereas another church may not have experienced the same number of transitions that we have. But to that point, even for those churches who have opened or who remain open, the statistics show that it's only 30 to about 50% of your original congregation size on a Sunday morning that's coming. So even if you are open, you're still more likely to see those who will watch the service online as opposed to coming back in the building. And quite frankly, I anticipate that happening going forward. Just because the building is open doesn't mean that everyone is still going to be comfortable coming back. I think that'll slowly progress as we go throughout the year, but it's going to take some time, I believe, before there will still be a number of people who worship in person that will resemble what we looked like before we went out.
Yeah, great. Thank you for that feedback. I do think that the faith-based communities have done a phenomenal job with providing access through social media and other means, and I know it's been so appreciated by so many. I wanted to spend just a couple of minutes talking about the Johnson & Johnson vaccine, and I'll sort of kick this off and then ask Dr. Dwamena to also make some comments. As we discussed earlier, I'm sure many individuals are aware that the Johnson & Johnson vaccine, the FDA and the CDC, approximately 2 weeks ago, asked to have that vaccine paused so they could look at data that had come in related to a rare blood clotting disorder. And so the pause lasted approximately a week and a half. During that time period, the CDC, a subcommittee of the CDC that advises on immunizations, not just COVID, but really all vaccines, met twice to look at the data from the cases to try to identify was it a causal factor with the vaccine. And essentially, this rare blood clotting disorder, at least in the cases that have been seen in the U.S., seems to or has occurred predominantly in females, females between the age of 18 and 49. It is a very rare side effect, but it is still something that the CDC wanted to take a look at. At the end of the day, the vaccine was released the end of last week to be used again. There has been additional warning language put into the fact sheet that all vaccine recipients should receive in order to inform vaccine recipients of what some of the risk of the vaccine are. So if you are interested in getting the Johnson & Johnson vaccine, and I'll ask Dr. Dwamena in a minute to talk a little bit about what this means for Virginia, but I would just really encourage you to educate yourself on the new warnings that are in place so that you can make a good decision about which vaccine is the best vaccine for you individually. Again, the Johnson & Johnson vaccine does have some benefits in that it is a one-dose vaccine, and there are certain populations where that might be beneficial, such as homebound individuals where it may be more difficult to get a second dose, and other populations. So Dr. Domena, can you talk a little bit about where we are in Virginia related to the Johnson & Johnson vaccine at this point?
So in Virginia, Johnson & Johnson vaccine is available. Vaccinate.virginia.gov is the website that residents, anyone can go to identify where vaccine is available based on their zip code, and also search by vaccine type. VDH has looked at the recommendations provided by the CDC and FDA and taken that into consideration. And in following the recommendations, have decided to resume administration of Johnson & Johnson vaccine. And that will also include the Peninsula and Hampton Health Districts as well. Similar to what Cindy said earlier, there will be additional language providing informed consent for those who still wish to receive Johnson & Johnson vaccine. We all know that the vaccines are effective in preventing severe disease, illness, and death of coronavirus infection. And when we look at vaccines, we weigh the risk and the benefits. And no vaccine, no medication for that matter, is without risk. And when we look at efficacy, when we look at what is considered safe, it really is a comparison of those two factors. And upon deliberation, the decision was made that the benefit that is seen in the Johnson & Johnson vaccine, the benefit of preventing severe disease and illness or death, especially for those who are at increased risk, whether it's based on their medical history or their exposure risk, that benefit is greater than the small percentage or risk of a severe complication, as was noted prior to the halt. We continue to encourage people to be informed, to do the research themselves, but also consult with a medical provider or a health professional if they have access to one, and really look at not only their medical history but also their risk factors and make an informed decision. Fortunately, now we are at a point where there are 3 types of vaccine for individuals to choose from. So there is opportunity to search and decide which vaccine is best for you.
So I'm now going to ask Pastor Swan a question because he's going to have to leave us a little bit early this evening. So if you could tell us before you leave, what are the reasons that made you get the vaccine? And if you had a parishioner that stated, they weren't interested in getting the vaccine, what words of wisdom would you give them?
I think that we have to look beyond ourselves. I'm pretty fit, and so if I were to have gotten the coronavirus, I'm reasonably confident, although you never know for certain, that I would survive it. But I wasn't thinking about me. I'm thinking about my parents. I'm thinking about my aunts and uncles who are elderly, and the fear of even wanting to be in their presence for risk of possibly spreading the coronavirus to them, and the impact that could have. The last thing that I would ever want was if something were to happen to my mother or father, it would be because of me giving them the coronavirus. That has been my great thought and concern. And so that's one of the reasons why our church is still not open, because not only do I think of my parents in that way, I think of all of our elderly in that way. You just don't want to be a carrier of one to give it to someone else. And so, yes, there are some people who are younger, maybe may think I don't need to take it. When we're younger, we always think that we're more invincible than we might really be. But it really isn't about us. It really is for other people and their consideration. One thing that I also like to mention, and this is not always discussed when we're talking and having these conversations, is that we have to also address the elephant in the room with this conversation, and that is we know that the topic of the coronavirus has been highly politicized. And regardless of which side you are on, it really isn't the issue. What really is the issue is what we have been saying in this forum all along. You really need to go beyond the politics of this, really educate yourself, really go to reputable sources to get good, accurate medical information so that you can make your decision. When we weed out all of the other voices that sometimes can infiltrate and get into our thought life and what we should or shouldn't do, and we go to the right places, I believe then we will make better decisions. And for me, the best decision was to get vaccinated, not only me, but my entire family as well. I would like to take a moment also before I leave to thank all of the other host churches that have partnered with us in these efforts. These vaccination clinics have not been just the work of one church, but several churches in Hampton and Newport News and other places who are working very hard to spread accurate information, to build the trust of its congregants, and to get people to get vaccinated if they want to do so. So I'm very grateful for the support of the network of churches that have come together to address this issue and to help people to get vaccinated.
Great. Thank you, Pastor Swan. Great words of wisdom, and I completely agree. I mean, I've had the opportunity to work with some of the churches locally through the community-based clinics we've had, and it's been wonderful outreach to get to their congregants and educate them and provide resources and access to vaccine clinics in the communities in which they live. So at this point, I'm going to turn it over to Sarah, who should have some questions from our audience.
We do, and this is a reminder, if anyone has questions or comments, they can leave them in the Facebook chat. But Christopher, I'm actually going to send the first question to you.
Sure.
Jennifer asks, as a millennial, how can we encourage others in our age group to get vaccinated?
That's a really good question, Jennifer. I think it kind of has to come from community empathy and having kind of a compassion for not just yourself, but for other people. We kind of had a couple other panelists, like Pastor Swan, talk about it a little bit earlier, but we just kind of need to think outside of ourselves for a moment. Sometimes it's good to be selfish, but when it comes to things like getting vaccinated, we really need to be mindful of other people because this virus does not care. It does not discriminate. It will, it will pass to anybody, regardless of age, regardless of gender, regardless of race and ethnic origin. It's a virus, and that's what they do. So we kind of really just need to kind of gently remind ourselves that this is more than just for us. This is for our parents, or our loved ones. It's just something that we just need to do to kind of make sure that we don't become carriers of this virus and unintentionally give them something that they can never recover from or still struggle with. There are still some side effects, such as loss of taste and smell, that affect some people after getting the virus the first time. And just hearing about that just breaks my heart, because if somebody in my family were to have those symptoms that just lasted and I couldn't do anything to help them with it, or do anything to kind of just alleviate that pain or the suffering that they're going through, and that's just on the light scale of it. The whole other scale is death in some cases, and it's just crazy to me that we don't kind of take ourselves out of the situation and kind of think about other people. So I think we just need to have more empathy for others and kind of just remind ourselves that getting this vaccine means that we can go back to some semblance of normalcy. It may not be perfect, it may not be exactly like how it was before the virus, but it'll have some semblance of normalcy where we can have family gatherings without having to fear, if I have to be masked or 6 feet away from somebody. We can have some semblance of normalcy and not panic when we go to a grocery store and forget our face mask or something. And it's one of the things that just boggles my mind that people just don't think about is if we all work together in this, then, we can put an end to this.
Thank you. And Dr. Duamena, Holly wants to know, where does someone go to sign up for the shot? And if you don't have insurance, is it still free?
So the best way to identify where you can get the shot is by going to vaccinefinder.org. Vaccinefinder.org is a website that is started by the CDC, and that site will give you all the locations where vaccine is available. You can also go through vaccinate.virginia.gov. So there are two links that you can go to, enter your zip code, and it will give you all the different options from location to type. You can see the hours. So a lot of the vaccine providers in the community have flexible hours. So you're not confined to the weekdays during work hours, and that's been very important for us to make sure that our community has that type of accessibility to vaccine. So that really is the best way for you to find vaccine in the community. And I believe the second part.
Is there a cost?
So there should not be a cost for the actual vaccine. The vaccine is free.
And do they have to be a U.S. citizen, or can anyone get the vaccine?
Anyone can get the vaccine. There is no restriction or limitation or resident status or income status.
And then another question for you, Dr. Duamena. So if someone is a James City County resident, can they come to a clinic in Newport News to get a vaccine, or do they have to stay where they live, where they reside?
Absolutely. They could come to Newport News. The Peninsula Health District is comprised.
And Pfizer will have an approval for those 12 and above probably sometime in May, and we understand Moderna will not be far behind that. So we expect that those 12 and above will have vaccine options over the summer, which will put us in a good position for middle and high school aged individuals going into next year's school year. For those that are under the age of 12, the pediatric population, that will take more time because there will need to be more extensive clinical trials, including dose-finding trials, to ensure that the correct dose is being administered. So we don't expect that we'll have vaccines for those under the age of 12 until sometime late this year or early in 2022. But for those 12 and above, we do expect that there will be vaccine availability within the next month or so.
Thank you, Cindy. Now, Dr. Duamena, Michelle wants to know about how are the decisions made about where the clinics are hosted, and she's asking, why are we doing things differently than the South Side or other parts of the state, and why are churches leading the effort for the clinics? Can you kind of talk a little bit about how the health department is working with churches and other organizations on vaccine clinics?
So I mentioned earlier that we have a coalition called Operate Vaccinate the Peninsula. And within that coalition that's led by the health district, it also involves the local health systems, that's Riverside, Centera, Bon Secours, as well as the locality leadership. We gather and we confer and identify where areas of need are. We also outreach to the greater community for input and ideas of where we could have clinics. Initially, at the beginning of the vaccination effort, the focus was on having areas and facilities that were large in size and that could provide vaccine en masse. So identifying larger facilities such as the Visitor Center in Williamsburg and the Hampton Roads Convention Center were areas that we looked into. And we were primarily limited by the amount of vaccine that we had. So we didn't have the luxury of distributing vaccine in as many places as we can now. The health districts, each of the health districts are different. The staffing is different, and the vaccine supply is different. Not every health district gets the same amount or even type of vaccine. And a lot of factors go into that, and the state determines allocations for the different regions and the different health districts. So that plays a role in how we distribute vaccine and the strategic approach. one size does not fit all in this instance. So what works for one district or one community or region is not necessarily applicable to others. Resources are different. And so we really have to look at the needs of the community, the demands of the community, and the resources that we have available. Hampton and Peninsula Health District, we have been very successful in collaborating with community partners and health systems to help consolidate our resources and also consolidate a consistent flow of information so that we can best assess the needs for the community.
Thank you. And continuing on the discussion about clinics, Christopher, you have volunteered at the clinics and worked there. What were some concerns you heard from people as they were coming in? And what's some information you'd like to share? Because I know some people might be a little nervous to go to a clinic.
Sure. So I would say don't be nervous. Everyone is there to either volunteer or be there to get you vaccinated. The whole goal is to make you as comfortable as possible, whether that's the first step of checking you in. It may seem like a lot of different checkpoints, but it might look different now. But it's all meant to make sure that we get you the vaccine and that you don't have any adverse reactions should you have any allergies to what's in the vaccine, any components that are in it. I think that was some of the main concern people had. Another concern was whether or not they were eligible to get the vaccine. I know that was a huge thing when I first started volunteering for the vaccine clinics in the Hampton Roads Convention Center was, are they eligible? And then another concern was, did I register correctly? When I worked at the registration desk, there are a lot of people who didn't register properly, so we had to make sure that we got them an appointment, either that same day, later in the day, or at another clinic that had an availability. So it just depends. But overall, I would say the operations run smoothly. Their goal is to get you in, get you vaccinated, and let you go home and be with your loved ones. And that's what I loved about doing it, and trying to make sure that all of kind of like the people working together can get the communication that they need properly to make that happen so smoothly. And it was wonderful to see the city of Hampton step up and kind of work with Riverside and Centerra and other community partners to kind of make that happen. You have so many people, such as our first responders, who are helping with vaccinations along with Centerra and Riverside Medical Group. And it was just amazing to just even see them be in that capacity and have people who save lives actually make a difference, and you see it up close in person. It changes you.
Thank you, and thank you for your passion and your dedication. As Cindy, he mentioned eligibility, and in Virginia now, anyone 16 and over can get the vaccine. Can you talk about which vaccines the 16 and 17-year-olds can get?
Yeah, right now the only vaccine that the 16 and 17-year-old age group can get are Pfizer. And I think that has caused some barriers up until this point. Of course, we know that we just went into phase 2, which opened it up to all individuals in Virginia a few weeks ago. But, even prior to that, as we were in phase 1C and 1B, there were some essential frontline workers that were 16 and 17. So I think the most important thing, if you're looking for a vaccine clinic opportunity, and you are either a 16 or 17-year-old yourself, or you are the parent of a 16 or 17-year-old, when you do go on to vaccinefinder.org, you can actually search by vaccine type. And so it does give you the ability to screen for the vaccine type. And so you would want to screen for Pfizer and look for locations that are offering Pfizer. There are many pharmacies that are offering Pfizer. Most of the medical practices that are associated with the health systems locally, both Riverside and Centerra, are offering Pfizer vaccine. And the local large clinics that are now being run by the Virginia Department of Emergency Management, the location that's at Sherwood and Warwick in Newport News, and now at the Hampton Coliseum, are both also offering Pfizer vaccine. So I think now more than ever, there are many opportunities to get the Pfizer vaccine for 16 and 17-year-olds, as well as the rest of the community within a number of different venues.
And should people try to get one vaccine over another? Are they equally effective?
Yeah, so when it comes to the Pfizer and the Moderna vaccine, they're very similar vaccines. They both have the same vaccine technology. They both have very equivalent efficacy, both at, roughly the 90% or slightly greater than 90%. And so really it's the vaccine that is available at the clinic, unless, again, you're 16 and 17 where you do need to get the Pfizer. But really you should, be fine getting either of those vaccines. Again, the Johnson & Johnson vaccine, a little bit different. We now do have that new warning, and so I do think making sure that you read the information and consider that. It is still a very good and effective vaccine, but with that new warning, it is important to read the fact sheet and then make the best decision for you based on your health conditions.
Thank you. And Dr. Duamena, if someone is homebound, how can they get a vaccine?
We have, beyond Vaccinefinder.org, we have worked with several community partners, including Meals on Wheels, to identify those communities and those populations that are homebound and in need of vaccine. So the best way and what I would recommend is that they can in fact, go to vaccinefinder.org, but they can also call the number 1-877 Vaccine VA, and they will be able to direct the individuals looking for a vaccine to the health district, and then through that we can identify the group, whether it's Meals on Wheels or if it's the locality that is performing that service to the community.
Thank you. And Cindy, another question. We're starting to hear boosters being mentioned. Are we going to need to get boosters?
Yeah, it's looking like we will be going down a path with boosters. And really, I think we understood that would probably be the case from the beginning. Much like we get an annual flu shot, there will be some type of follow-on injection for these vaccines. What we don't quite know yet is what the timing will be for that. Both Pfizer and Moderna are in clinical trials looking at the booster dosing, looking at whether any slight changes need to be made to the vaccine based on the variants that we're seeing around the world. And so I do believe in the next several months we will have better information around the timing for that next injection. But we do believe whether it's the Pfizer, Moderna, or even the Johnson & Johnson, which is now a one-dose vaccine, we do believe that there will be some type of booster that will be required in the future for each of these vaccines in order to keep the immunity at the level that we'll need it to prevent another, epidemic or pandemic related to COVID.
And staying on this same topic, Dr. Duamena, is the Virginia Department of Health already working on planning the booster clinics, or have you all already started to think about how they would be rolled out in the community?
We have preliminary discussions about that, but until we have a more formal timeline of when that will take place, then we'll have more formal plans that we can actually share with the community. But the great thing about having the coalition that we have is that we've developed an infrastructure with the local leadership and health systems that when that time does come, we can easily stand up clinics in certain sites and within communities. So I'm confident that when that time does come, we already have systems in place that can accelerate delivery of booster vaccinations when that time does come.
And staying with you, so today's warm weather really got us all thinking summer is coming, and college students are going to be returning. So the college students who might have been in another state, another part of the state, got their first vaccine dose where they're living for school. If they come back to this region, can they get their second vaccine here in the region?
Well, we try to accommodate everyone who is residing in the peninsula, whether it's as a temporary resident, that being a college student, or one of our local residents. So we currently have enough vaccine that we should be able to accommodate those college students who come and are in need of their second dose. And that is something that has pretty much been well established now that we are finding in individuals who are seeking their second dose and have already received their first dose.
Thank you. And Christopher, during the pandemic, people have really struggled to stay connected. How have you stayed connected with friends and family? And what words of wisdom or suggestions do you have for people who might feel disconnected or isolated right now?
That's a great question. Isolation is one of the hardest things, especially when dealing with the pandemic itself. One of the ways that we tried to stay connected with friends was we would have like weekly game nights together, and we would just all be on a voice chat party. For family, we would kind of do like weekly check-ins and just, make sure everyone was doing okay, have FaceTime calls or Facebook Messenger video calls. And that just kind of gave people a little bit of reassurance. And that's just kind of like the only thing I could really think of. But I guess my biggest thing to kind of impart on you for any wisdom about isolation is just talk to somebody. If you don't know, if you don't feel comfortable reaching out to somebody and you feel alone, look up some local resources. Virginia, especially around the peninsula, we do have warm lines, which is somebody who can talk to you and be a friend to you, and just kind of talk you down of any anxiety you may be feeling, or any worries you may be having. You can also just kind of see what kind of local resources your local library has. A lot of what we do is transformative for our communities. So we try to make sure that the gap between mental health and medical information is closed. So if you have information, or if you want information about mental health resources in your community, feel free to ask us. We would definitely be more than happy to look up the answer for you, and we would gladly give it to you.
Thank you. That's great information. Cindy, why do some people have bad reactions to the second dose and others don't? If I don't have a reaction, does it mean it didn't work for me?
Yeah, so, it's really interesting because everybody really develops immunity in different ways. Typically, when you're having side effects, it means that the vaccine, you're actually developing immunity to COVID. So the vaccine is working, it's doing its job. But everybody responds and develops immunity a little bit different. So, it may be that you get the injection and you have a little bit of pain in your arm, but somebody else may have headaches or, may have flu-like type symptoms the day after. So it's all very normal. I think when we think back to flu vaccines, different people respond to flu vaccines the same way, and it really is your body's response, that immune response that your body is mounting. So it doesn't necessarily mean that you haven't developed immunity, just everybody responds a little bit different when they get the vaccines.
All right, and that is all the time we have for most of our questions. I'm going to ask the last one, and this one actually goes to everyone on this panel. So everyone here has been vaccinated. Why did you get vaccinated, and what does it mean to you? And we'll start with you, Cindy.
Yeah, so I think first and foremost, as a healthcare provider, it was really important for me to get vaccinated as soon as the vaccine was available, and I did take advantage of it within the first week of when it was available to healthcare providers back in December. And there's a couple of reasons for that. First and foremost, we're patient-facing every day. So we want to make sure we protect ourselves, but we also want to make sure that we protect those that are around us, whether that be coworkers in our hospitals or whether that be our patients. But then I think very similar to what Pastor Swan said, on a very personal level, I have two elderly parents that are in their late 80s. I provide some of the caregiving services for them. I fill my father's medication boxes. I draw up his insulin syringes. And during the pandemic, they've been very isolated. They've not been able to have, anyone come to their senior apartment unless they were a caregiver. And so it was very important for me to get vaccinated so that I could support those that I love, support my family, and make sure that I was safe going in to provide care for them. So that's why I got vaccinated.
That's beautiful. Thank you so much for sharing that, Cindy. I think one of the reasons why I got vaccinated was not only just to help my community, but just help my friends and family. Being isolated for so long was just very exhausting. And, being vaccinated kind of opened up the doors for me to kind of just say, well, now I can see you comfortably, still masked and still distanced, but I don't live in fear of transmitting a virus to you that could potentially give you terrible side effects or even kill you. So that was one of the greatest things for me, is just peace of mind and knowing that, it may not be a cure-all, but it is something that can alleviate some of the stress within my life and the lives of others.
So simply stated, my decision to vaccinate is based on the risks and benefits of not getting vaccinated versus getting vaccinated. It's really quite simple decision for me because knowing what the purpose of vaccination is for and having that information, it's very clear to see that, when you look at benefit and risk, that you can make an informed decision, not only for yourself, but also for your family. And making the right decision is not only a act for yourself, but it's also an act of love and consideration for your family and your friends. And I think that, when you have that information and you have a clear understanding that, again, nothing is perfect, nothing is guaranteed, and that we are in a pandemic where there is a lot of uncertainty, and we have at this point in the pandemic have done a remarkable job of using the technology and the information that we have to create vaccines that can alleviate a lot of the death and illness that we're seeing and experiencing in our communities. And the vaccine is a major part of ending this pandemic, but it's not the only part. There are still treatments that are being worked on to treat the infection. We still have preventative measures like hand washing and wearing face masks. So it's not just the vaccine, but that is a key component. And so again, even for those who choose not to be vaccinated at this time, it's still important that you still do your part in preventing the transmission of disease. And hopefully with time, with platforms like this where we're able to engage and speak to you about not only our experiences from a personal experience, but also professional experience, that more people will become more confident and comfortable in the decision that they do make to get vaccinated.
Thank you so much for joining us tonight. I really want to thank my panelists. I hope that you have been able to get some of your questions answered and that you're better informed around the COVID-19 vaccine and specifically about Operation Vaccinate the Peninsula. Good night.